There you go. Dr. Gomez, I would like to talk about, gum disease or periodontal disease, as you guys call it. Now, here is something I have observed. Every dentist tells a person that he got to take care of his gums, because if not, the gums shrink, the bone shrinks, he loses his teeth, and that is devastating. Now, while I agree with that losing all the teeth is devastating, and you have mentioned how that makes your bone shrinking, how you start looking ugly, and yes, you guys can replace them. It is what I mean. Yes, you can replace them with implants, with all kinds of stuff, and as long as there's money around, you can do that. So, yes, it's still bad, but it looks to me that while your teeth are falling out, which must be taking at least 3 to 5 years, if not longer, having that gum disease in it, looks to me that gum disease really is yellow, reddish pus. It's like an infection. It's in your gum and it drips into your blood. And when you eat food, it mixes up with those bacteria, that infection, and the food goes in your stomach, and from there it travels. So it looks to me every minute you poison your body. You ruin your kidney, you ruin your liver. I've heard that there is babies which are born premature because of it. In California, there even was a lady who had a stillborn baby. Now, that's a one in a whatever, maybe the only case. We're not talking about extremes here. But if you can have a premature birth, if you can have liver, heart disease, strokes, kidney failure, wouldn't it be safe to assume that your immune system is crashing and that the next flu season, whether it's a bird flu, a swine flu, or just the next flu season, and everything else will hurt you? And it looks to me that that's a much bigger problem than losing the teeth, because at least you dentists know how to replace them. Tell me, am I far off with this? Am I totally off the wall?
No, not really. Actually, what we're trying to teach the patients, or try to make the patient understand that it's very important for them to keep a good oral hygiene. And we recommend the patient to come every 6 months to get a dental checkup and cleaning, and make sure that the gums are healthy, because it has been proved that gum disease can affect your health in different ways. All that you say is correct. Yeah, that's what gum disease can cause to the patient. Premature birth, heart problems, liver problems. All of that have been related to gum disease. And if the patients prevent that from happening by having a good oral hygiene and coming to the dentist as often as they need, they will prevent all those issues from happening to them. And now we try to keep the patient more informed about how they can prevent all from happening. And it's not just the cleaning, it's not just coming to the dentist to get the cleaning, it's the home also care that they have to maintain.
Sure. But so the point is, what you're saying is you do agree that an infection in your mouth, which is the gateway to the blood vessels. Nothing, right. It's a gateway to the blood vessels. And as I said, the food mixes up with this infection, brings it in the stomach. From there it goes everywhere. If a person would have an ingrown toenail or some infection on the hand, just a little bit, like a quarter,
right,
he would go to the doctor if it doesn't go away within a couple of days.
Right.
And yet he keeps having a much larger infection in the mouth for years.
Yeah, some patients, they don't think that is important. They see the gums bleeding, and sometimes they don't pay attention to that. And most of the time I ask the patient, if you had bleeding eyes, will you go to the doctor? And they say yes right away, because they think that's important. But when they see the gums bleeding, they don't pay attention, and it's really, really very dangerous for them, because all the medical issues that they can be developed from gum disease.
Right, and again, I don't know. Correct me if I'm wrong, but it looks to me again, having a missing tooth, yes, is bad, but at least you can replace it. But once the kidney and the liver is damaged, how easy is that to fix? That couldn't be that easy. I mean, we heard about it all the time.
Exactly. We hear about in the news everywhere. You can, have a lot of information, and people now are getting more aware of those issues because of all the news, internet, everywhere they go, they see a lot of information about that, and people are just getting more aware of those situations.
Good. That's good, and I hope that this video will do some of that too, and I'm sure it will. I mean, after all, not only most likely do you have bad breath and it smells, because that's what infections do, they smell. It wouldn't matter how much you brush. If the infection is 3, 4, 5, 6 millimeter under your gum, you're not going to get rid of it with brushing anymore.
No, not really.
No, not really, right? So there you smell, number one, and you poison your body. And if an immune system is low, I think it might even have something to do, and probably does, with being fatigued, exhausted, and tired, because that's what infections do. They drain your energy.
Yes, exactly. Well,
maybe we should end this video so that I can go to my dentist and make sure I don't have an infection. You convinced me. Bye-bye, Dr. Gomez. Appreciate your informative and candid comments here. Thank you very much.
You're very welcome.